Hello, my name is Cortland Robinson, and today I'm going to be talking about the Affordable Care Act. The Affordable Care Act was put into place in March of 2010. It's also sometimes known as the ACA, the PPACA, or Obamacare. According to healthcare.gov, the law has three primary goals. Number one is to make affordable health insurance available to more people. The law provides consumers with subsidies that lower costs for households with incomes between 100 and 400% of the federal poverty level. Number two is to expand the Medicaid program to cover all adults with incomes below 138% of the federal poverty level, although not all states have expanded their Medicaid programs. Number three is to support innovative medical care delivery methods designed to lower the cost of healthcare generally. I personally am for the Affordable Care Act. I personally believe everyone should be able to receive some sort of medical attention, even if it's just a routine checkup, a visit for someone who is sick. They should at least be able to see a medical professional once or twice a year. The Affordable Care Act makes this possible. As HealthMarkets.com's list, one of the pros of the Affordable Care Act is being able to get free preventive and wellness visits with no copay or deductible. NCSL lists some of these preventive services offered. It lists adults getting blood pressure screenings, cholesterol screenings, colorectal cancer screenings for adults over 50 years of age, depression screenings, HIV screenings, immunizations, and at least 11 more. Another reason I support the Affordable Care Act is because it covers more American citizens than Medicaid does. As I read from reports, healthcare.com, the Affordable Care Act is affordable for the majority of people. Most people usually try to argue, why don't we just use Medicaid to help people? Well, I used to think the same thing until I did some more research and found out on visionshr.com that Medicaid is run by the state and is more for patients in desperate needs, and they are strict on whom they do and don't help. Because they are so strict and stuff, a lot of people are not approved for it. But I understand there are policies, rules, and stuff like that they have to abide by. The Affordable Care Act is through the federal government. I think the Affordable Care Act is a good alternative to help people whom cannot get approved for Medicaid or people who do not have insurance at all. In all, I think the Affordable Care Act is one of the healthcare policies I think strongly of. I think no matter how rich or poor a person is, everyone should be able to receive some type of medical attention. I don't think anyone should spend their life suffering from not being able to see a medical professional. I hope y'all enjoyed my presentation on the Affordable Care Act, and I hope I answered any questions you may have. Thank you.